Video coming up I shot on Wednesday this week. This lady had found me on YouTube after surgery and she said, you know, you don't have a video of having a K-wire removed from a toe. She said, will you do me? So I said, okay, fair enough. So this lady, 6 weeks post-correction of an adducto-varus toe. And by K-wire, it's a Kirschner wire used to, well, we use them for all sorts of indications in pod and orthopaedic surgery. This is a hammer toe fix I did a few years ago with a chevron osteotomy. So this one is left fourth toe with a neuroma as well. Chat to the camera. So this young lady, won't mention your name, Karen. This young lady is 6 weeks post. What do we do to you, Karen?
You straightened my toe.
I did. What else did we do? Do you remember the other bit? That's easy for you to say. We did, didn't we? That's okay.
It's not. It might be okay for you.
Oh, so are you NHS or private, Karen?
I'm private.
Okay. Oh, careful. Stay in shock now. Stay in shock.
Oh, look how dry it is.
Well, so's my sense of humour.
Look at the dry skin.
So we'll get that pin out. Now we normally have a little bend on the wire. Normally. But because you're a bit nickel allergic, we had to use titanium. And the titanium ones bend and break. So that was a straight one. So people looking at this across the world will go, why did that pin not have a bend on it? And it's because you needed the special stuff because you're a bit delicate.
Okay.
So. Well, I do have that effect on women. You know, I tend to make it's a sort of a nauseous feeling. I have that effect on them. So. That should just come straight out. Oh, don't do that. There you go. 3, 2, 1. Oh. So that's it.
Oh, well, I myself up for that.
I know. Were you worried about that?
Yeah.
To be fair, you're not the first woman I've disappointed.
Wow.
So that's it. So it's blue. It's titanium.
Nice.
So normally they have a bit of a bend on because you use the steel. I was going to put that there because that has to go in the bin. Now they always, Karen. They always bleed just a little bit at the end because you've got an hole. Now, you'll remember your toe was 45 degrees bent, wasn't it? So it's now nice and straight. So we're going to just cover it for 2 days because we can't allow any bugs into that. Because if we look on the x-ray, if you got some bugs in it and it went straight down, this is true. It's not a good look. So, dry for 2 days. This can come off, what day is it today, Shafir? Wednesday. Dry.
Friday, yeah.
This can come off on Friday, and then you can get it wet, you can take the dressing off yourself.
What about that other bit? Is that looking nice?
Underneath, that's the neuroma sac. Can you see that on the camera? So this is where we did the neuroma gene. That's underneath, so that's healed really well.
Does it really good?
Yeah,
Nice.
really nice. So poor old Karen had 2 issues. She had a trapped nerve and a bendy toe. So 4 weeks if we were just doing a neuroma, but 6 weeks for a toe because it takes a little longer to heal.
Yeah.
Karen, that looks great. Really super pleased with that.
Yeah. Fabulous.
To be fair, with the really bad hammer toes, the pin can be that long.
Oh, God, it was.
And they can take a little bit of persuasion to take out. That was an easy one, so that's fine. Which
I
is
was
just
expecting it to be worse than that. I thought, oh, I'm going to feel
It can be, with the ones that are really stuck in, if they're really long, they can be a little bit stuck.
I imagine.
Making sure we're still
That's
in.
nice bandaging.
It's not my first rodeo, you know.
It's better than the other lot, even. Honestly.
This is just because of. So
Feeling it tighter
I have seen it rarely because if you get an infection in, it goes
Yeah.
all the way down.
I don't want that, do I?
No, you don't. It's not a good look having a deep infection, my dear.
So does my other bit look okay?
It looks really good underneath. Yeah, because remember that was dehisced a bit,
Yes.
so that's fine. That was just some superficial dehiscence. It's healed really well.
Yeah.
So that's really good underneath. So 2 days for that. Dressing comes off on Friday.
Yeah.
Jump in the bath.
I cannot wait.
Okay. Slowly get back to activity,
Yeah.
and then we'll see you for a 6 month checkup.
Okay.
That's got to go in the bin. I'm afraid you can't keep it.
I don't want it really.
Questions? What else can I tell you?
Questions. Work. When I go back to work.
How active are you? What
Well,
do you
I'm
do?
a healthcare assistant at a doctor's.
So you're on your feet a lot, or have you got a sit down job like me?
I'm on my feet quite a bit. So I've sort of told them that you said
Did I? Is that what I said?
No, it wasn't you. It was. I think what the name is the other one. We've done my surgery.
What's the word I'm looking for?
You're understudy.
Don't tell him that.
Who
I mean, he is, but don't tell him that.
Yeah, you're
My colleague.
Your colleague.
Yeah, I'll do you.
Well, he said 2 more weeks off. But
Yeah.
I thought, oh, is it?
Up to you. Depends how it feels.
Because they said I can do sit down, like bloods and.
Do you want to do another week and then you can see how you go? All right.
And then I can sort of go.
I'll stop the video there because we're just nattering now. And that was K-wire out. So we typically dress them for 2 days to prevent bacterial ingress. There is a risk of an infection all the way down the shaft. This is from another case I did, hammer toe 2 and 3. So K-wire or Kirschner wire is the most simple form of fixation that we use. So really that reminds me, it's about time I did a few videos on orthopedic fixation, metalwork and compression, AO principles, etc. So I've got a few little errands to run over the next few weeks, but yeah, I think I'll do something on fixation over the spring. Thanks for watching as always.